Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today, I was trying to remember if I've had anybody on for a second podcast yet. You might be the first, Dr. Barbera.
Wow, I'm so honored.
How does that make you feel?
Thank you very much.
You're an electrophysiologist with Monument Health, Dr. Barbera. And joining him today is Kelly Brandsted, the CNP. Welcome, Kelly. Glad to have you here.
Happy to be here. Thank
Now,
you.
we got Dr. Barbera's background. If you haven't heard the episode on Holiday Heart, it was one of my favorite episodes that I did because it was just one of those things that nobody knew about. And afterwards, they were like, well, now I've got to be careful. I've got to find a better way to enjoy the holidays.
Like I said, I think I did kill the liquor store sales in the area.
So, Kelly, you're
Smith
native, correct? You're from here.
Yep.
So, what's your background then? Were you born and raised here in Rapid City?
Not born here,
Okay.
but raised here, grew up here, graduated from Stevens High School. I won't tell you the year because it was a long time ago.
We never mention age or year on here. No.
I got my nursing degree through USD. And got my NP, and I've been working for Dr. Barbera here for the last 3 years.
Excellent.
I think I work for you.
Well, you do.
Well, and speaking of that, that's kind of interesting because how does a relationship like this work from a doctor and a CNP standpoint? Do you guys, like Kelly, do you work with other doctors too, or are you mainly with Dr. Barbera and vice versa?
There's 4 nurse practitioners that work in our department, in
Okay.
our little electrophysiology department. And so we work, all 4 of us work with both Dr. Barbera and also Dr. Levine.
Got it.
We just kind of split our time. And
Kelly just tells me what to do. I do it.
Well, I mean, sometimes you need that for sure. But it must be, you guys must, it must be like any relationship in a professional setting where you've got to really trust the person that you work with too, I'm assuming as well.
Well, I mean, Dr. Barbera got me fresh out of nurse practitioner school. So if you can say someone was a baby and didn't know anything, that was me. So we've come a long way together because
Yes.
he had just started here in Rapid City, and so
Yeah, I can't believe it. Time flies.
It-
3 years ago.
Yeah.
Over
Yep.
3. And you came out, but you'd already had experience. And, you worked in the cath lab before and were pretty clinically sharp. It was just a specialty that you needed, some training on extra, work with the electrical part of it. But you'd already had a big cardiac background, and I think, you caught on quickly.
Well, and that gives people that are coming to see you guys lots of confidence too, when they can see how well you work together. I mean, that it's got to give you guys the same amount of confidence too, right?
It does. It makes me feel so comfortable to know, when Kelly tells me something, I can rely on it. It's going to be what I need to know. It's going to be without exaggeration, or she can call out the problem, and then she puts the problem in front of me, and then I can work with her and the patient to figure out what's the best next step. And we've had a great 3 years, and I really am thankful to have Kelly to work with.
Well, and that's super important when you guys are dealing with what is still the biggest killer of people in the United States, which of course is heart disease. So having a good team together is so necessary, and that's kind of what we're going to talk about today. We're going to put just a little twist on this, though. So often when we talk about heart disease, it's kind of a general topic. We're talking, what everybody can kind of do to protect their heart. But today, I think we want to focus mainly on the differences that happen with heart disease between men and women, specifically for women, because I was pretty surprised in doing a little bit of research on this, just how much difference there is when it comes to women and their heart health. So we'll just jump right in with risk factors for women, which kind of surprised me. Can you
Yeah.
talk a little bit about that?
Well, yeah, I think when it comes to men and women, the major risk factors are the same. You've got diabetes, smoking, high blood pressure, high cholesterol, stress. So those risk factors are going to be the same no matter your gender. But women also have the additional added risk factors, such as pregnancy and things that can happen to you, diseases that can happen to you during pregnancy, your autoimmune type diseases, lupus.
Does that mainly affect more women, lupus?
I believe
Yes.
so.
Really?
Yes.
Okay.
More common in women. for
Okay.
sure.
Yep, it does. And I was just at a conference actually, and one of the speakers from the Mayo Clinic was talking about how even though there's the same risk factors for men and women, those same risk factors affect women almost more so than they do men, such as stress. So high stress. Is a risk factor for coronary disease. Women seem to be higher targets, higher risk factor for if they lead a high stress lifestyle, something stressful happens to them, their risk actually is higher than men to be affected by that stress level, which I found very interesting.
Yeah.
So like even once a woman if they have diabetes, their risk of coronary disease, heart disease becomes the same as a man. So they quickly can catch up. And menopause, when that hits, there's an acceleration of risk factors. And that's when women really start to catch up to the men with heart disease and problems. I mean, women below 50, they tend to, they all will know other women that have had cancers, breast cancer, for example, and they worry a lot about that throughout their lives, and women typically think that would be the number one killer. But women, thankfully, a lot of them, they live longer than men, and they live deeper into life. And so after they hit 50, then they, really start to catch up to men, and ends up being, 30% of female deaths overall are cardiac related. So women have to realize that from the beginning, that if they have a good, healthy lifestyle, good habits, 80% of the heart disease that women get, if they get it, can be preventable with a good lifestyle.
So you mentioned pregnancy and breast cancer. Do those definitely then, do they put women at higher risk, obviously, for heart disease? Is that correct?
Which one?
Either one, pregnancy or breast cancer. Yeah.
I mean, I don't know exactly how breast cancer could, except if the treatments sometimes for the breast cancer itself. So if you got radiation treatment to your chest wall, that would increase your coronary disease development risk. And it does lots of negative things to the whole cardiovascular system. Radiation treatments have gotten better. In the older days, we used to see people with really big doses and they'd get more heart disease. And chemotherapies themselves can provide risk for heart disease. So adriamycin, for example, is one that we worry about, where patients can develop cardiomyopathies, heart muscle weakness from that chemotherapy. And we try to make sure women are being very carefully screened when they're being dosed with that kind of drug for their breast cancers to prevent them from getting heart failure. It's a balancing act. Obviously, you're trying to cure a cancer, and at the same time, you don't want to cause a new problem.
Well, and I'm sure the stress that goes along with breast cancer would probably play into that too a bit, right?
That's another one.
Right.
Right on. Yeah.
Okay. Is an age difference for women too when it comes to heart disease? Do they get it younger, older than men? Does that play a big factor too?
Well, like Dr. Barbera was saying, once women have a little bit of a protection until they reach menopause, but they're now finding more and more that younger women are having coronary disease, and they're having cardiac events at a younger age than we previously had thought. So it's not something that you can just say, oh, I'm good till I'm 50 at least. But that's unfortunately not the case, and it's kind of scary to think about, but it's also good information to have.
So what age should they get screened at then for something like that? Is that just general yearly check-ins with your doctor sort of a deal?
Yeah.
Yeah, it's definitely just regular check-ins with your doctor. It's being thoughtful about your symptoms. If you develop them, then you you're gonna ask for an evaluation a little sooner on that. But the screening is pretty much standard throughout life. So the key really is just educating our population of people to know when there's a symptom that means something, and also educating them about good lifestyle. During pregnancy, though, just to backtrack a little bit on to what you talked about before with some of the things that can happen earlier in life, like breast cancer or pregnancy, which is much more common. Pregnancy can definitely get you going with risk factors because women develop hypertension, preeclampsia, gestational diabetes, and those women are much more likely to go on to develop cardiovascular disease if they've gotten it during pregnancy. It doesn't mean necessarily they will, but if they've gotten it, it puts them at higher risk. So they should be watched a little more closely.
Mm-hmm.
I've read also about endometriosis. Can that play a part of it too? Can that be a factor that plays into heart disease a little bit?
Want to take this one?
Well, and I guess I don't really know all the ins and outs regarding endometriosis, and it's tied to coronary disease, but I think it plays along in that autoimmune type disorder.
And it just seems like anytime you would, like going back, the stress to me seems like the umbrella to all of this, because when these conditions arise for women that are scary, and then there you go. You're going to worry about
endometriosis, you just got basically some traveled uterine tissue that's gone somewhere where it shouldn't be.
Right.
And that can create tremendous pain during menstrual cycle. So I suppose the stress of that could really make somebody start to not take as good a care of themselves.
Sure.
You can start to get somebody off a good track, and one thing leads to another.
Right.
You can see it happen. It happens to cars we drive.
Yeah, exactly.
It can happen to humans even more so.
Now let's specifically talk about heart attacks as far as heart disease goes, because I think everybody believes that if you have a heart attack, it's always the dramatic movie scene of clutching your chest, and that's the heart attack, and that's where the symptoms come from, and come to find out that they're pretty similar for both sexes, but there are some specific differences, I think, that women should recognize when maybe a heart attack is popping up, right?
Absolutely. And, and Dr. Barbera can attest to this too, but, during my years working in the cath lab, we would see people men and women, as they came in with an active heart attack. And I can say more times than not, most women did not say, I had a sudden intense left-sided chest pain that radiated down my left arm, which is what we're all taught to be the classic sign of a heart attack. It's more vague symptoms, shortness of breath that started all of a sudden. You're sweating and you don't know why. You feel very anxious. You've got jaw pain and maybe an upper back pain, or your stomach doesn't feel quite right. The kind of symptoms that women would describe to me of their heart attack was not typically your general, like you said, movie scene type symptoms, which I found very interesting.
Yeah, women will keep you on your toes.
Well, we try.
It's true in so many ways, but it's like the baseball analogy. It's a knuckleball coming at you. It's you got to be vigilant with a female who's got complaints that don't they didn't read the textbook. Not necessarily I have an elephant on my chest. It's I've got this between my shoulder blades maybe, and it's a weird, they won't say pain, but a weird feeling, and they've short of breath a little bit. It could be lots of things. They could be on birth control, and maybe they got thromboembolic things, that clots traveling to their lungs. They got pulmonary emboli, which are more common for a woman to get. Or you might actually be having a heart attack, and, we've got to try to sort that out. Good diagnostics, thankfully, help us figure that out.
But those are definitely signs. If any woman is, any person really, I suppose, is experiencing similar. But is there, you said the pain in your chest traveling down the right arm, left arm rather? Is that kind of the same for both men and women? Can that same thing happen, or is that more lean one way or the other?
The most common presentation is still women and men will both potentially have that chest pain, and it can radiate down the arm. That's definitely most common.
Okay.
But it's more common for women to have an uncommon presentation
Okay.
of a heart attack, and it might not go down their arm. They might have upper abdominal discomfort, and that's unusual. It's very rare for a man to be having a heart attack that way, but a female can much more likely do that. There's studies that show it, and so we're taught to be on the lookout for the atypical presentation, especially in women.
Well, we talked about heart disease a little bit. You're saying now that women are seeing this a little bit younger too. Is that same with like specific heart attacks? Does that happen at a certain time in a woman's life, different than a man?
And it's still most common as women age.
Okay.
The same with the man. As you get older, your risks go up, and the chances go up that you'll have some sort of coronary event or heart attack. But yes, younger women can have heart attacks.
Absolutely.
And is that really more to lifestyle or more to heredity?
I'd
Both?
say both.
Okay.
Both, definitely both. But like, for example, smoking as a risk factor for development of heart attack is more likely to cause heart attack in a woman than a man. So it's been studied that smoking ends up being more likely to cause heart disease in women than it would be a man. So they really got to watch. It's modification of those risk factors as soon as possible. So if you ask, when should women start thinking about modifying their risk long-term for heart disease, it's basically from the time that they are young, when they're developing. Because if you get the good habits, you avoid the smoking, you keep your weight down, and you're active and physically on the go, learn how to blow off stress, do things like that, you've given yourself a much better chance right out of the box. You're going to reduce your chances of developing diabetes over time because your weight's better. It's such an important thing, just to make women realize it's not just to worry about breast cancer, which is obviously very important, but cardiovascular disease, stroke, for example, is more common in women than men. So women will have, and that's a cardiovascular disease, stroke coming from a brain blood flow problem, things like atrial fibrillation or